So during this rotation, thankfully I can say that I didn't have too many difficult patients. I think most of my struggles with patients this rotation came from a language barrier, with there being a large Armenian population at the clinic that I was at. The adjustment to have to frequently use translators was something that I'm not used to, being that I'm fluent in Spanish and the area that I live in and the clinics that I did some volunteer work for before starting PT school. I found that the second language was something that was beneficial to me and something that I really never gave a second thought to, because generally I was the one that people would try to seek out to help provide some help with translation, or if I did encounter Spanish speaking patients, it was very seamless for me. So this being the first time that I had that um, difficult language barrier, even with the use of a translator. um, I can remember during the first rotation when I would sometimes still have to use a Spanish speaking translator just because my CI didn't speak Spanish early on. Before she and I kind of developed a rapport, she wanted to make sure that she understood everything that was being said from the patient to myself and myself to the patient. Um, but I just remember sometimes with those translators that they wouldn't translate everything appropriately, um, and it was difficult to not be able to speak directly to the patient. So that's something that I kept in mind when using translators here at this second rotation with some of these patients who only spoke Armenian. And for the patient that I have in mind, it was sometime during the fourth week. I was doing an evaluation to see if this patient would be appropriate for pool therapy, because they had very high irritability and they just were very intolerable of a lot of exercises on land. Um, they just couldn't do much. It wasn't so much, I think, for pain. The patient, for some reason, just like fatigued very easily. They had tried land therapy once before, and the patient themselves didn't like it. And then their doctor informed them that they could try pool therapy, which is what they came to get their evaluation for this second time around. So for this patient, I ended up having to use a translator because they only spoke Armenian, and most of the interaction was actually going pretty well, up until the patient revealed that they had some form of urinary incontinence. At which point, my CI kind of looked at me and she had told me beforehand, like, that she would probably jump in just to get those questions out of the way because sometimes they can be a little bit uncomfortable. So she did, and she was basically trying to explain to the patient that based on her urinary incontinence that she would not be appropriate for pool physical therapy, just so that there wouldn't be like any risks of infection to herself or to the other patient that would be in the pool at the same time that she would be, and just kind of like a hygiene risk. And it ended up just being something that was hospital policy, and our patient didn't take it very well. It was kind of difficult, but we could both tell that she started getting a little bit flustered, a little bit upset, even telling us that we were starting to offend her. And we tried our best to use a translator because, but there came points where the patient started cutting the translator off, and it was just very difficult to get through the rest of the session. And eventually, the patient just ended up getting up and walking out. So I think with this patient, one of the more important things I learned is the importance of language, and how these barriers can definitely have an impact on the quality of care that we can deliver. Because I feel like if the patient had spoken English to some degree, it might have been a little bit easier to explain to the patient what it was we were exactly telling her, because she kept repeating herself and telling us that she didn't have any incontinence, and that her issues only occurred every now and then, that they weren't constant. So I think just for future sessions, doing our best when there is a language barrier to make use of all the tools that we have available to ourselves, because at this specific clinic we did have some front office workers and some aides that were fluent in Armenian, and I think just having that person to person dialogue would have been a lot better, and taken the patient would have probably not reacted quite as strongly as they did, but just having that awkward conversation with a student being there, my CI being there, and then having that translator on the iPad, I think didn't help the situation.